All right, well, let's get rolling. Thanks so much, y'all, for joining today. My name is Smash or Brittany, depending on where you know me from. I will respond to both. I use she, her pronouns, and I am the Congregational Engagement Manager at the Night Ministry. And I'm really glad that you all could join for our LampLight lunch. We are doing these lunches, bring your own lunches once a month on topics that intersect with our work at the Night Ministry. And we are really excited today to be talking about harm reduction, but particularly harm reduction for faith communities. And I am pumped to be joined by two awesome colleagues, and I would also say co-conspirators for all things good and holy. I think I can say that about both of you, and you'd be down with that. We have Rev M Barclay, who is the director at Infleshed, and also with us is Noam Greene, who is our lead street medicine outreach worker at the Night Ministry. So thanks to both of you for being here to lend your knowledge and experience with us today. For other folks, we'll have some open time at the end for y'all to ask questions, and I'm happy for you to introduce yourselves then, or if you want to just pop who you are in the chat and where you're from and why you're here, that would be really great as well. Otherwise, we can do that when we kind of have an open discussion. The way today will work is I'm going to ask Noam and Em some questions that I have prepared ahead of time. Then you all will be able to ask any questions that you want as well. And just as a heads up, we are recording this. We typically post these publicly afterwards. Primarily, I send them out in my newsletter to faith communities, and I think the Night Ministry posts them in some other ways as well. So just want folks to be aware of that. And if at any point you want to say something, I can definitely edit that out if you don't feel comfortable with that being public. So definitely let me know about that. All right, so let's just get rolling. We're going to start with Noam. And Noam, I'm wondering if you could tell us a little bit first what harm reduction is and why it is important to us at the Night Ministry.
So harm reduction is not one specific program. It's more of a philosophy and kind of a method of doing outreach. Harm reduction is based on the idea that we meet people where they're at as far as their drug use or their drinking or, whatever their situation is. We respect the autonomy of the clients to make choices about their own bodies. And we try to provide items that will reduce potential harm that might come out of, certain activities. So just like now, we put a mask on before we go to the grocery store, or maybe you have some hand sanitizer in your car for when you get back in the car. That's a good example of harm reduction, because you still go to the grocery store, but you just take precautions to reduce potential harm that could happen from that situation. So what we provide is clean needles and syringes, clean pipes, and then safer injection supplies. So that would be alcohol prep pads, clean, cookers, and I can get into the details of what all this stuff is if people are interested. But long story short, we try to keep people supplied with things that will improve their health over the long term. And there are tons and tons of studies that show that using a new needle every time reduces skin and soft tissue infections, reduces emergency room use, and can even prevent more serious or deadly illnesses like endocarditis and things like that. We also provide Narcan. So Narcan is an overdose reversal drug. So if someone is in an opioid overdose, you could administer Narcan and it will reverse the overdose. So that's very important because, a lot of our clients, if they're using certain drugs, they might not have a phone to call 911. They might not trust, the hospital system to call 911. So it's really about putting the power back into the hands of the clients to make good, healthy decisions for themselves, rather than us kind of imposing what we think they should do or we think is good for them.
Thanks, Noam. That's helpful, especially with the focus on autonomy. I think that's really important. That is a great foundation. Em, I'm hopeful that you can tell us a bit about why harm reduction is important to faith communities.
Yeah, I'd love to. And I think that there are a million reasons that we could talk about that would all be fun to talk about. But I just want to highlight three that I think are some of the most important. And the first is that people who use drugs and people who do sex work, which I also associate traditionally with the work of harm reduction and harm reduction movements. People who use drugs and do sex work are a part of faith communities, and so to invest in this work and this principle is simply about paying attention and caring about who is a part of your communities, whether you know they are or not, and investing in the work that will contribute to the flourishing of these communities. Second is that harm reduction is a natural outgrowth of most faith traditions. And I think the harm reduction model offers a way to really deepen into so many of the love and justice practices that faith traditions espouse. As Noam was pointing out, like I hope you can hear some of those overlaps between the principles of harm reduction and maybe how your own faith tradition speaks to practices of justice and supporting autonomy and practicing solidarity when systems are coming to diminish life. And I think it's a great entry point for white communities who are wanting to engage in anti-racism work, but not knowing how. A lot of churches I'm hearing, in particular, white majority churches, talking about a desire to deepen their engagement in anti-racist work, and harm reduction presents an opportunity to do that faithfully and meaningfully. And then third, I would just add that historically, many faith communities, and I'm coming from Christian tradition specifically, so most certainly my tradition, but many other traditions as well, have been living the opposite of harm reduction, have been contributing to the world that we have today, the culture that we have today that criminalizes drug use and sex work. And I think that wherever traditions and communities and theologies have contributed to conditions of harm, contributed to stigma and isolation and criminalization and death, that there is even more of a responsibility for those same traditions and communities to actively learn, repair, and support efforts for change.
Thank you. Yes to all of those things. I'm wondering though, for folks in faith communities that we might be thinking like, yes, like we hear that theologically, that makes sense, but how do we actually go about this? I know some faith communities are probably have already leaned into harm reduction a bit more than others, but how can a faith community get started in supporting harm reduction?
Yeah, so 5 options I will offer you. First of all, learning about overdose prevention as a community. Maybe you start with yourself, maybe you start with a staff, maybe you start with volunteers, but creating a community plan in your faith community to address overdose, taking some online trainings about how to use Narcan, making sure you have Narcan in your faith community. I imagine these folks can point you towards some places to get Narcan. Chicago Recovery Alliance has some online trainings that you can watch from home to learn how to administer Narcan, and it's very easy and low risk. And so even if it feels intimidating, it doesn't have to be, it doesn't need to be. So that's number 1. Number 2 is just learn about and pay attention to the language that you use for people who use drugs and people who do sex work. Language is just one tiny part of creating cultural change, but it does reinforce moral frameworks and reinforces stigma depending on what words are used. And so learning about which words people who use drugs and people who do sex work prefer, and sticking with those is a small thing, especially if you're a religious leader. Ensuring that you're using positive words from pulpits and other sort of places of moral authority matters a lot. So I'm a part of a group called Faith in Harm Reduction, and you can check it out at faithinharmreduction.org. And if you go there, you'll see a whole toolkit that we put together that has so many great starting places, including a sort of chart of words that are encouraged and discouraged and why. So I would encourage checking that out. And then third, I would say you can start with learning about the history of drug use in your tradition. Was there once a respected place for stimulants as sacred? Was your tradition a part of colonizing communities and stigmatizing drug use? How has your tradition contributed to morally stigmatizing and criminalizing drug use and sex work? Learn about the history, and then figure out what role you and your community want to play in creating a different future. And start preaching and proclaiming the moral truth about the past and the present and the future. Fourth, I would offer learning about how to support people in your communities who are people who use drugs or who have friends and family who use drugs. So many people who lose loved ones to overdose are then on top of the grief of that, isolated and shamed in their grief because of the stigma. And so actively choosing to be a part of breaking the silence in conversations around drug use and overdose, stopping the stigma that is, it's there until disrupted in our culture, right? It makes me think about it's so similar with communities asking about how to support queer and trans people. Like, don't wait until you know that there's a little trans kid in your community to then start trying to open the discussion of trans inclusion, right? It's the same idea. Don't wait until you are aware that there's somebody in your community that is a person who used drugs or somebody who has lost somebody to overdose. Like, create the space for that person, those folks, to then know where you stand on that before there's an explicit and obvious need. And then last, I would just say, getting connected to communities that are doing advocacy around drug use and sex work, contributing to systemic change at the local level in regards to national laws, and specifically learning about the impact of the criminalization of drug use and the war on drugs, and especially in Chicago, the impact of that in regards to policing being increased in Black and Brown communities on the basis of criminalizing drug use. So learning about what folks are doing to overturn some of these histories is a great way to get involved.
Thank you. Those are really helpful. And I posted that website in the chat for anyone who wants to check it out, Faith in Harm Reduction. They have some great resources on there. There's also a toolkit that I'll be sending out as a follow-up to this as well that I think is super helpful for all of us. And I'm wondering, I know one thing I hear from faith folks and faith communities is there's a lot of tension and difficulty, I think, for faith communities to even know how to talk about drug use and sex work. And there are folks who have trouble, I think, coming to terms with their own ideas of morality. So can you talk a little bit about that? Have you seen that as well?
Yeah, absolutely. And I get really excited about harm reduction work, and I don't want to minimize the challenge of engaging in this work because of the moral framework that has been very intentionally grown from the far right, from the right since the 1970s, when Richard Nixon declared drugs public enemy #1, as if that was the launch of a moral campaign to create exactly the struggle that faith communities and individuals are facing today, trying to wrap our minds around what we have been told, all of these horrible things about. And I think like so many cases of discrimination and prejudice and bias, we have deep unlearning to do that is requires intentional labor, that requires education, that requires being open to accepting that there have been forces that have been intentionally shaping our thoughts about a thing, right? And have been intentionally shaping how we view people who use drugs. And I think in as much as communities feel curious, at least, about drug use, and curious about listening to people with lived experience, and hearing alternatives than we have been provided, outside of what we have been provided, that's a good starting place.
Thank you. Yeah, I hear that. The deep unlearning and deep listening, I think, will really help folks continue to lean into that discomfort. Because I think most of us know, who are affiliated with faith communities in a faith tradition, that growth and transformation and new life, if you will, only typically can come out of discomfort, right? And deep unlearning and deep listening. So thank you for that. I think right now we have Sam in our room where we keep all of our supplies. And Noam, you mentioned maybe we could take a look at those supplies. Sam, is that something that you could make happen
Sure.
for us?
What do you want to see?
Noam, what should we see?
Okay, so back in that other aisle where you were, where all the harm reductions and medical stuff is.
So these are the alcohol prep pads. Right now they're on the floor because I was putting some rogue ones away. We have wound care kits. Band-aids are up there. There's some more band-aids over here. Condom kits, syringes. I'm kind of still getting like the feel for it. This is my first day reorganizing. There's, I think, more syringes up here.
Yeah.
Yeah.
And then way up at the top of that shelf is all the sharps containers. So we give those out to clients as well. Yeah, somewhere in that pile of things.
There they are.
We give those out to clients so they can safely dispose of sharps. Oh yeah, there you go, right there.
Awesome. Thanks, y'all. We normally don't let people see our storage because it's wild in there, but you get a special glimpse today. Thanks for being with us, Sam.
Sorry.
No, I appreciate it. I think it's great for folks to see. And trust me, our storage looks so good compared to before we moved, which it would have been easy for lots of us to get lost in that old storage room. But I'm wondering, I know, Noam, you're here in Chicago, and you know Chicago well, even though you are not here currently. What would a robust system of harm reduction look like in our city?
You should go first.
I mean, I can just share a sort of ideal dream world that would be great to manifest in Chicago and everywhere. But it would include a few things, like everywhere, so many different institutions, faith communities included, but certainly not limited to, just having Narcan on hand, everybody being trained in the use of Narcan, it being a sort of normalized, they've got those like, what are those heart, those medical things on the walls in so many different places, and so many different people are trained in just using that. But if Narcan were more more familiar to everybody in that way, even though I can't even remember the name of those, which is, anyway. So Narcan everywhere. I would say collaboration across a lot of different organizing communities, harm reduction being work shared across queer and trans communities, Black and brown communities, that groups would be working in collaboration to decriminalize drug use and to build communities of care and support. Educating medical institutions in Chicago, the amount of stigma that is alive and well in hospitals and all of the medical industry towards people who use drugs would need to be addressed significantly and robustly. Dreams of having safe consumption sites, which just means where people can be in a supportive environment, not be using drugs alone or in isolation, where people have a sense of safety and support from others. If there were sites across Chicago, that would be a dream. And more support and centering of organizations who have been doing harm reduction work for a long time. I know the Night Ministry is doing this work, and Chicago Recovery Alliance is doing this work, and Southside Harm Reduction and Brave Space Alliance. It would be a dream to see more Chicago support for those histories of organizing. Yeah.
Yeah, 100%, all those things. You know, this is not like official Night Ministry opinion, but I would love to see decriminalization, because, you know, we run into a lot of problems with trying to get people housed and with them having past convictions for possession. So it does have ripple effects in that way. Yeah, safer consumption sites. I mean, all the literature on those, like, there's been no deaths at any safe consumption site anywhere in the world, which is like, yeah, just an obvious difference from street drug use. I mean, I would love to see universal health care, because a lot of people, the reason that they start using street drugs is because they have had an accident and they're in severe pain, and they cannot afford to get like medical care. So what they can afford to get is street drugs to treat their pain. So yeah, I would like to see some type of like universal health care. Again, these are big, you know, magic rainbow world ideas. Yeah, and then I think the way that we kind of conceptualize like drinking as a culture, you know, like we have so much merch and like t-shirts and stuff that are like wine moms, or like, you know, like you'll get your dad like a grilling apron with a beer on it or whatever. It's like, we know that alcohol causes so many deaths, so many illnesses. It's like 5% of the global burden of disease. So, but yet we still have ways to reduce harm from drinking alcohol. And like, you don't go to jail for having a bottle of wine in your bag. So for me, it seems like kind of taking that conceptualization and applying it to other substances.
Thank you, Noam, and thanks, Em. Those, yeah, those are some big, wonderful ideas, and I think, yeah, they all intersect, and I see a lot of folks working on them, and I'm hoping that faith communities can get on board as well, because yeah, there is a stigma there. There's a lack of understanding. There's tension, but I I believe, as a faith leader myself, that if we're going to be people of justice, of making justice, that this work is really important for us to lean into as well. I do know at the Night Ministry we are hopeful, and I think doing some advocacy and other work for safe consumption sites in the city. I think that is more than just like a long-term dream, right? I think we're actually trying to make that a plan and a goal. And I'm hopeful that we're going to have a LampLight lunch, particularly on that sometime this year. So stay tuned for that. But I want to open it up now and see if other folks in the call have any questions about anything we've talked about so far for Noam or M or both. And feel free to type them in the chat or unmute yourselves as well.
So I'm in like education, like Sunday school type things. And there's like a possibility that I'll have an opportunity to work with like middle school, high school age. Are there resources around this type of education, like for that age range, or like, because it's like, you know, how do you defend this to the parents kind of a question, I guess. I mean, I know how I would, but yeah.
I mean, I'm not aware of any curriculum oriented towards that age. I feel like even in faith work around harm reduction for adults, there's just so little available so far. I think that there's an incredible group of people working to try to change that, but curriculum is not readily available. I think, I don't know, just applying some of those harm reduction principles would be a great entry point for teenagers. But you definitely have to kind of construct that yourself, I think, as far as I'm aware, which is only.
That's fair. Thank
As
you.
a former youth minister, like I feel for you because
Yeah,
it's real. Yeah, I mean, I have not been able to find anything like that. I don't know, I guess like I agree with M, like starting from the concept of harm reduction, you know, like maybe don't jump into like, here's the type of needle people usually use, you know what I mean? But just keeping it more general, I think that could kind of make people a little more comfortable.
I love the idea of even just like normalizing in faith communities, especially I'm thinking Christian spaces where this isn't often the case, but like teaching from a younger age to meet people where they're at. I mean, like that alone is a game changer for so many different realities of the shared life that I think can go a long way, setting them up to be harm reductionist in a wide variety of ways. Yeah.
Yeah, I think those are great ideas. Unfortunately, we don't have a lot of great youth curriculum for a lot of things.
Right.
So if anybody wants to start doing that with their lives, I support that fully. Yeah, I think focusing on dignity, I think we don't do that very well in a lot of our faith communities. And even just that is like a basic concept. Is really helpful. And then you can give the parents lots of statistics because parents like statistics, right? About how helpful and life-saving harm reduction really is. So that's the direction I would go. Anyone else? Questions? No question. Well, I don't want to say that. I understand we are all at very different places on harm reduction. So please feel free to ask what you don't know.
I just wanted to ask about that chart that you mentioned earlier with language that you could use. I went on to the website, which looks awesome. There's a lot of great stuff there. and I saw a chart that was geared towards elected officials. Is this the one that Em, you had mentioned?
I actually am thinking about in the Spirit of Harm Reduction Toolkit, which on the website under resources, you can access the Harm Reduction Toolkit. And then if you scroll down on what opens, it will have somewhere in there a chart with language. But another way to access it would be by Googling media resources, inclusive language around drug use. I know that there's a lot of replications of these kind of charts that address problematic language. Yeah.
Cool, thank you. Yeah, I work a lot with elected officials and neighborhood groups, so I really like this chart that I found because it kind of mentions like common phrases and why you shouldn't use them and what to consider using. So I thought that was really great, instead of just telling someone, oh, don't say that, that's, you know, politically incorrect, or, you know, it kind of describes the meaning behind it and an alternative. So I thought that was really cool.
Yeah, thank you for that. It's so important to learn the why we change language. Yeah.
Mm-hmm.
Yeah.
Hi, I'm kind of new to this, so I really appreciate the lunch that you put on today. It's really been interesting, and I've learned a lot about the kind of the issue and the vocabulary and all. So thank you very much for that. I was interested in the safe sites, the safe use sites. Is that something that among drug users is a popular idea as well?
Yeah, Noam, I don't know if you want to chime in first. But
Yeah, I mean, the thing is, like, it hasn't really existed in Chicago. But that being said, people see, I mean, it's not uncommon for us to hear that someone like overdosed and died in someone's tent, and then they had to wake up and there was a deceased person in their tent. So if there was a better option, yes, I think people would use it. And you can also find a lot of research on the successful sites in Vancouver and Toronto. Again, with the statistics, there's a lot of good numbers coming out of there. So yeah, I mean, obviously I can't predict the future, but I think if there was a better option, people would use it.
mm-hmm. Yeah, and the key, just not the key, that's too singular, but a primary key just being not being alone, right? Chances of dying from an overdose alone versus in a community of people who are watching out for each other, taking care of each other, who have access to Narcan, and are not having to watch their backs for the police to be around them, is the difference that makes in terms of dying from overdose or not is significant. Yeah.
I don't have the numbers in front of me, but I know there was recently a study particularly looking at the west side of Chicago and what a safe consumption site would look like there, because on the west side there is a disproportionately high number of deaths from overdose. As we know, there is a huge racial disparity in our city with health access in the first place. And again, I don't have the numbers in front of me, but I think they did demonstrate that drug users would be willing to use a site like that, and that the community did see positive, would see positive outcomes, that the community really thought that it would be helpful to connect folks, to make the neighborhood safer, to reduce some negative behaviors, kind of whatever, you know, all the things that people talk about, like, is this going to be good or bad? So I can also send that study along with the stuff I send to you all afterwards as well. I think it's really helpful.
I think it's helpful just to like wrap our minds around, especially at first, like thinking about safer consumption sites, like at bars being akin to safer consumption sites around alcohol, and the difference that can make in community versus in isolation, right? And how the intentionally crafted space makes such a big difference, and like yeah, just kind of everything around the use of alcohol, and how normalized that is, bars are in our culture. And like it helps, I think, to kind of break through some of that like inability to imagine for some folks. Not that it would be the same thing, but that there would be similar things, similar impacts.
Yeah, and I also recommend reading Dr. Carl Hart. It's H-A-R-T. I believe he's like a psychopharmacologist or something very fancy. He does research at Columbia, and he's written a lot of books about drug use and the stigmatization and like the positive effects of drug use also. So he's a good resource, yeah.
Noam, can you drop that name in the chat? You broke up a little bit as you were saying that. Thanks. Other questions?
I've seen some theory like floating around the internet that harm reduction is like a philosophy. But usually when I hear it talked about like by people in real life, it's very like concrete. It's like harm reduction is like, and then they like describe like a method of harm reduction. So I'm wondering like, what is the deal with that?
Are you asking like what the philosophy is, or what that disconnect is, or both, or?
I guess both. I think like when I hear people saying like harm reduction is a philosophy, it's usually to argue that something that someone is saying is harm reduction actually isn't.
Sure.
So I guess I'm wondering what the disconnect is.
I mean, I don't know. I'm just going to kind of babble for a second because I don't know exactly, but I do know that there are, for instance, some differences, and especially it depends on like state law and how harm reduction is playing out in different places based on what's legal and what's not to do in terms of harm reduction. But I know that there's some separation between what some like grassroots harm reductionists are doing versus like more institutionalized public health centers that are not always grounded in harm reduction principles, like meeting people where they're at, like supporting people's agency, like some folks who are professing to do the work of harm reduction, but still making drug use inherently morally negative. I think that disconnect sometimes brings up important conversations about the why behind the philosophy of harm reduction, and that relational piece, that also like places that are handing out Narcan but not talking about the racism of the war on drugs and how that's, you know, affecting the use of drugs and the practices of sex work. Yeah, I think the way that these things are all webs when they're disconnected from each other, maybe that's part of what's being named there.
So like harm reduction is also about like the mental health in terms of like how people think about themselves. Does that make sense?
Yeah, I mean, I think that is,
Sorry.
no, you're fine. I think that that's a part of the philosophy of harm reduction would be to care about how people feel about themselves, right? Whether they use drugs or not, whether they are working to abstain from drugs or working to change their relationship to drugs or just need safe supply. Like for harm reduction would say like, none of these choices make you less of a valued and loved and beloved human being, right? And that being a principle, I think would be one element of the approach. Yeah, a sort of holistic. Yeah.
Thank you. That really makes sense and explains a lot.
Mm-hmm. I think so many, there's, for so many folks, there's only been access to abstinence only programs around drug use. And that certainly is important for some people. It works for some people. But the philosophy of harm reduction is that that doesn't work for everybody and it doesn't need to work for everybody. And I think that's another example of where faith communities can expand what they have to offer and sharing space and not contributing to a narrow approach to drug use. Abstinence only doesn't work in most like situations of anything, and so yeah, harm reduction really wants to open up the mindset of what's possible for people to live lives of thriving, lives of safety, lives of healing, and there are many ways to do that, and that's key to the philosophy. Yeah. Again, greatly applicable to many things. Yeah.
Yes, all the things. Maybe next time we'll go through a list of all the things, but maybe not. You can private message me for a list of all the things that abstinence-based curriculums only won't work for.
Yeah.
I'm wondering, Em, you said before that it would be great if all faith communities could have Narcan on hand. How do folks get Narcan?
Great question. I don't know. Do y'all distribute Narcan at the night ministry?
Yeah, so we distribute Narcan. Chicago Recovery Alliance also does.
Mm-hmm.
And then there's a couple other agencies, but Chicago Recovery Alliance is the big one.
Mm-hmm.
Probably not everyone on the call is living in Chicago, but there are many harm reduction like community groups, mutual aid groups. You know, like one I've been connecting with is in Central Arkansas. So there are plenty of groups. It might take a little digging, but I'm happy to help with that. I can put my email in the chat if anyone's having trouble finding somewhere to get that.
There's also, I believe, a link on the Faith and Harm Reduction page where you can even access naloxone being mailed to you if that would be best, which I think especially in the pandemic might be helpful. Yeah.
Thanks, y'all. That's helpful. Anyone else? All these questions have been really great. So does anyone else have anything? All right. Well, Noam or Em, do you have any departing thoughts with us, last words that you'd like to share before we close up?
Well, I messaged Smash about this because I just want to say something really Christian because I am annoyingly Christian. But yeah, you know, we just celebrated Easter and then Orthodox Easter. So we're thinking about like the bodily resurrection. And I think that ties in so much with harm reduction because like Narcan literally creates a bodily resurrection. So obviously not everyone is in a Christian community, but that's just one way that, you know, might appeal to your
Mhm,
Thanks, Noam.
mhm. I don't think I have anything else to add. Yeah, that's a good note to end on.
Yeah. Well, thank you so much, Em and Noam. I really appreciated everything that you had to share with us today. And thanks everyone for coming, for your questions, for your presence. And come on next month. Next month, we are talking about displacement and something called renovictions, which are happening here in Chicago and everywhere. So feel free to check out our website at the Night Ministry to get the link for that Zoom. But we do this the third Friday of every month. And please reach out to me if you have any questions or if there is a topic that you're like, hey, I would really like to learn more about this. And we can see what we can do. So thanks so much, everyone. Enjoy your weekend and we'll see you next time.
Thank you.
Thank you.